Assalamu alaikum, I am Dr. Junaid Jahangir Awasi, and today I am going to tell you how to approach a patient who is a floppy child in your short case. You may be given the command of doing general physical examination and the relevant, or you may be given the command of doing motor examination and the relevant. In both cases, you need to keep six things in your back of the mind when you are doing the examination. Number one, hypertonic cerebral palsy. Number two, SMA. Number three, congenital myopathy. Number four, congenital myotonic dystrophy. Number five, neonatal myasthenia gravis. And number six, Prader-Willi syndrome. First of all, introduction, consent, and greeting. And when you are introducing yourself, look at the parents' faces. Note down any features of myotonic dystrophy or myasthenia gravis in the parents. Then proper exposure of the patient and have an overall look of the patient. I mean the general inspection for 30 seconds. And during these 30 seconds, don't touch the patient, just note down all the features of inspection. Look for any dysmorphic features. Look at the head size, look at the facial features, look at the overall posture, overall movement, any scars, previous scars, and the respiratory difficulties. I will go into details of these features later on. Once you have done the overall inspection of the patient, then if you are able to realize that the child is having a obvious hypertonia, he is floppy, then you need to do 180-degree maneuvers. For 180-degree maneuver, first of all, observe the infant in supine position. During this observation, note down the posture and the movements. Then gently make the child pull to sit. During this pulling to sit, note the degree of head lag, the neck control. Then place your hand behind the back of the child and make him sit and assess whether he is able to sit with support or without support, and what is the overall trunk control, what is the overall neck control. Then help him in standing and help him in putting weight on the feet, and note down whether he is able to put weight on the feet or not, and note down whether he is having hypotonia, or note down whether if he is having seizuring of the legs. Obviously, if he is hypotonic, he will not be able to put weight on the legs, on the feet. Then do the ventral suspension. By ventral suspension, we mean put the child like this. उसे उल्टा करते हैं और ऐसे लटका दें. Put your hand just beneath the tummy of the child. And during this ventral suspension, note down the posture of head, trunk, and limbs. Note down the degree of hypotonia. Infants with cerebral palsy may have extensor posture. And finally, place the infant prone, उसे उल्टा लटा दें, and observe and note down whether the child is able to raise his head above his trunk or not. Once you have done with these 180-degree maneuvers, then if your command is do motor examination and relevant, go to the motor examination, then do the relevant. And if your command was do the general physical and the relevant, then start from hands, go to the head, then to the toes. In the hand, look for simian crease, look for features of Down syndrome, see whether the hands are small like seen in Prader-Willi. From the hands, go to the head. In the head, see whether the overall head is small or large. Now, if you have hypotonia with microcephaly, think of cerebral palsy. And if you have hypotonia with macrocephaly, then you should be thinking of melingomyelocele and congenital toxoplasmosis. From the head, come to the eyes. In the eyes, note down any brush field spots, any squint. Squint may be seen in cerebral palsy. Brush field spots may be seen in Down syndrome. And in the eyes, also look for features of torch infection. From the eyes, go to the face. In the face, look for dysmorphic features. If there is hypotonia with dysmorphic features, think of Down, Prader-Willi, MPS, lipidosis. In the face, see whether the features are of like an ex premature child. If it is so, think of cerebral palsy. If the face is alert, think of SMA. Hypertonia with an expressionless face, think of congenital myopathy, muscular dystrophy, myasthenia gravis. Hypertonia with ptosis and ophthalmoplegia, same causes. If there is NG tube placed, think of hypertonic cerebral palsy, myopathies, muscular dystrophy, myasthenia gravis. If there is an oxygen placed, again think of hypertonic cerebral palsy, SMA, myopathies, muscular dystrophy. See whether the face is a fish-like triangular mouth. If the mouth is triangular, fish-like, think of congenital myopathies or muscular dystrophy. Note down the fasciculations of the tongue within the mouth for SMA. Then see the overall posture of the child and assess whether if the child is having a frog-leg posture. If there is frog-leg posture of the lower limbs, think of SMA, think of congenital myopathy. Note down any fisting in the hands. If there are fisting in the hands, think of cerebral palsy. Note down whether the child is having arthrogryposis, hypertonia with arthrogryposis, think of congenital muscular dystrophy and myotonic dystrophy. Then find out which is the main area involved. Is the face mainly involved? Is the lower limb mainly involved? Is the proximal limbs mainly involved? Or distal limbs are mainly involved? Face would be mainly involved in congenital myopathies, muscular dystrophy, or myasthenia gravis. The lower limbs will be mainly involved with meningomyelocele. The proximal limbs will be mainly involved in SMA and in congenital muscular dystrophy. The distal limbs will be mainly involved. See if there are any scars of previous intervention, like if you find a tracheostomy scar, think of infant botulism. If there is a gastrostomy scar, think of hypertonic cerebral palsy or congenital muscular dystrophy. Congenital myotonic dystrophy, sorry. Then note down the respiratory difficulties and note down the upper airway noise. Upper airway noise may be seen in cerebral palsy. Once you have done with the head, eyes, face, any upper airway noises, breathing, then in the chest, note down the shape of the chest, see whether it is bell shaped or there is splaying of lower lips, which is seen in SMA. Also, at that time, you should do the precordium examination, do the apex beat, and assess whether the child is having some sort of heart disease as well. The apex beat may be displaced with cardiomyopathy. Hypertonia with cardiomyopathy, think of Pompey's disease. Hypertonia with congenital heart disease, think of torch infections, or you may have heart disease in certain storage disorders as well. From the chest, go to abdomen. In the abdomen, look for hepatosplenomegaly. And in the abdomen, why hepatosplenomegaly with hypertonia? Maybe torch infection, maybe MPS, maybe glycogen storage disease, maybe lipid storage disease. Because lipid storage disease can have myopathy as well. Similarly, glycogen storage disease like Pompey may have hypertonia as well. From the abdomen, go to the genitalia. In the genitalia, look for hypoplastic gonads. The gonads may be hypoplastic in Prader-Willi. From the genitalia, go to the lower limbs. Now, in the lower limbs, in the lower limbs, you need to see the tone power and the reflexes. So when you are checking the tone, also note down whether there is hypermobility of the joints, because the joints may be hypermobile in connective tissue disorder. When you are checking the power, especially if in an infant, students start thinking how to check the power. Just remember, he will not obey your commands if he is an infant. Ask one question from the mother. क्या बच्चा टांगे उठा लेता है? If she says yes, the power is 3. If there is hypotonia and he is an infant, most likely she will say no. When she says no, the power is either 0, 1 or 2. Then gently stroke the lower limbs. If he is able to move them from sideways, the power is 2. If there is just flicker of contraction, the power is 1. And if there is nothing, the power is 0. Then check the reflexes. If he is an infant, age less than 1 year, don't go for planters. Just check the knee reflex and the ankle reflex. If the reflexes are absent, hypotonia with absent reflexes, make it SMA. If the reflexes are decreased, hypotonia with decreased reflexes, make it congenital myopathies or neuropathies. Hypotonia with normal reflexes, think of connective tissue disease. Hypotonia with increased or brisk reflexes, think of hypotonic cerebral palsy. Once you have done the lower limbs, then see whether the primitive reflexes are present or not. If the primitive reflexes like Morrow's reflex, placing reflex, sucking reflex, tonic neck reflex, stepping reflex, they are present, think of cerebral palsy. And finally, do the developmental assessment of the patient. So you should be able to narrate the developmental age of the patient. Once you have done this examination, you should be able to prioritize your differential diagnosis. If you found hypotonia with a fisting of hands or seizuring of legs or squint or microcephaly with increased reflexes, make it hypotonic cerebral palsy as your first differential. If during your examination you see that there are tongue fasciculations, the face is alert, the reflexes are absent, and the tone is decreased, make SMA as your first differential. If during your examination the reflexes are decreased, there are no fasciculations, the face is not alert, the baby is developmentally delayed, there is marked hypotonia, make congenital myopathy as your first differential. If you make hypotonic cerebral palsy as your first differential, make SMA as second and congenital myopathy as third differential. If you make SMA as your first differential, then put congenital myopathy as second and myotonic dystrophy as your third differential. If there are some dysmorphic features, then see whether the dysmorphic features are of Downs. If the features are pertaining to Down, make it Down syndrome. If the features are of not of Down, but there are dysmorphic features, put Prader-Willi as your differential, MPS as your differential, and lipidosis as your differential. When the examiner asks you about investigation, tell the investigations of the most likely diagnosis. And also tell, when he asks you about the management, tell the management of the most likely diagnosis. After doing your examination, must remember to cover the patient and say thank you because it has marks in your exam. This was all about examination of a floppy child and its differential